what we are seeing is like the dose modulation strategies have improved quite dramatically, which we can comfortably prescribe to all the adult patient. The reason why I'm saying adult patient means I'm still not comfortable with adopting the dose modulation uniformly for the pediatric population, because sometimes in the pediatric population, if the patient is not set properly in the ISO center of the gantry, the dose modulation can impart higher dose than it is needed. So as a medical physicist, we need to be careful about prescribing the dose modulation in the pediatric population unless you are independently verify on your scanner to make sure that it's working properly. But on the adult population, we do the dose modulation on all the patients because that is showing a dramatic decrease in the radiation dose overall. That is the take-home message I want to give about the dose modulation. Cardiac CT imaging. Probably a few years ago, very few centers did cardiac imaging, and I'm assuming now most of the places are doing cardiac imaging to some percent. Or most of your hospital, can I take a straw poll telling like how many of your hospital doing cardiac imaging on a routine basis? Which is good. So in the cardiac imaging, there are two things which is brought to our attention, because one thing is like the cardiologists are doing these procedures and surprisingly they call a medical physicist and like, how is my scanner fine? So they want, all of a sudden they want our help and they want the quick answer in 60 seconds. All they need to hear is yes or no. But that's where we are coming in to help or understand these things. To understand the cardiac imaging, there are two things which I'm going to discuss with the time frame. The acquisition of the cardiac CT data is very important. There are two types of cardiac CT acquisition data. First is called the retrospective ECG gating. What it basically implies is like,